We at Blue Shield are highly committed to making sure that lifestyle medicine is woven in to our partnerships with our physicians and that we're delivering it and making it available to our members.
It's moving beyond this model of medicine where it's like informed consent, really thinking about where the science and the theory meets real life.
As a surgeon, you deal with a lot of the downstream effects of how people have lived. Lifestyle medicine is the opportunity to change the trajectory of health for our members. It allows us to think differently about how to impact people's lives. At its most fundamental level, it means that we're going to live the healthiest life possible for as long as possible.
Often we're given like one of two options. You can take pharmaceuticals for the rest of your life, or you can have some kind of surgical intervention. And those are all perfectly appropriate options for people, right? But what about the third option?
There's a lot that we as physicians don't know about diet because we are never trained. The best way not to have to spend the money, if you will, not to have to put patients through the agony of the diseases is to make sure they don't happen in the first place.
We have clear line of sight relative to the science. We know these behaviors are helpful, and we're trying to help our members avail themselves of these behaviors.
With Blue Shield, I think this was actually a great benefit. Having the information helps you to be a little bit more conscious so you can make better choices. If you can do it now and save yourself, then for me, that's the best choice, to save yourself now.
Patients are more self-empowered. They have more information at their fingertips. They want to be more control in their care, which is perfect for lifestyle medicine. You have the best of both worlds.
Chronic disease to me implies helplessness. I'll take myself as a personal example. 2 years ago, I went into unsuspected atrial fibrillation. And all of a sudden I realized I was in that chronic condition category. And I said to myself, you know what, so I don't want to live like that. What are those things that are within your control that you can do something about? Every single day I need to make choices about how I'm going to eat, how I'm going to exercise, how I'm going to keep myself physically, emotionally, spiritually sound. It's a combination of all those things that creates that lasting change that then drives to that healthy life.
I have not ever seen a health plan that has worked so hard and had such success in getting these very vital goals for its members and for its employees accomplished.
Some of the things that I've learned are just to be more conscious about some of the things that I eat in terms of just making better health choices, really being conscious of the steps I take, so trying to be more active and soliciting friends to join me.
We want to be more than just a health insurance company. We want to be a health plan, right? And if you want to be a health plan, you have to be concerned with the entire health of your members.
Lifestyle medicine is critically important to our members, and as we explore and understand the science and the power that lifestyle medicine has to improve chronic conditions such as heart disease, lower blood pressure, lower high cholesterol, the science is clear, we're committed, and we believe it can actually give people options.
Blue Shield is becoming much more convinced that lifestyle medicine works because Blue Shield is applying it to itself.
By us investing in those programs, it makes it possible.
Let's decide together. I mean, that sounds like a more fruitful medical relationship to me. It sounds more like a partnership.